Hey there, welcome back. Today is video number 2 in our 3-part series on Medicare basics. Today though, we are going to get into Medicare coverage and costs. Super important information, and it's a lot of information today too, but this is where I feel a lot of the confusion comes from when we sit down with someone, and a lot of the questions tend to come from, well, what is that going to cover? Or how much is my out-of-pocket going to be? But I thought it was this. So let's break it down. All right, and we're going to start with original Medicare. That's parts A and B, like we discussed last time. So A and B. Now, if you'll remember, part B does come with a monthly premium of $148.50, and also has a $200 deductible per year. $203 deductible per year. What else are my expenses with original Medicare? Part A, although it doesn't have a monthly premium, it does have a $1,484 deductible. That's per benefit period. A benefit period starts when you enter the hospital and ends 60 days after you've been released from the hospital. So let's say, for example, you went into the hospital for surgery. It starts that day that you enter the hospital, and you get out 5 days later. So 60 days after you're released from the hospital is when that benefit period ends. Okay, so that's $1,484. But 5 months down the road, something else happens. You're back in the hospital for something different. You have another deductible to pay, another $1,484 deductible. With original Medicare, there is no limit to how much you may spend in your bills. There is no maximum out of pocket. There is no ceiling. There is no, There is no stop loss in there. Who knows? It could be sky high. It's unlimited how much they can bill you. You are responsible for 20% coinsurance, but if there are a lot of health issues going on, that's a lot of money. So that's original Medicare. Medicare Advantage plans. Let's go over here real quick. This is your Part C, right? Often these don't have a monthly premium. I would say about 90% of our clients who have Medicare Advantage plans, they're in plans that don't have a monthly premium. Often they include prescription drug plans, and that's referred to as an MAPD plan. So the prescription drug plan is built in there at no additional cost. You do, however, have your copays for your prescriptions, but it's all included into one plan. Copays and coinsurance are your responsibility. So, for example, if you want to see your primary care doctor, it may be $5, $20, could be up to $30. It just varies by plan. It's impossible to say exactly what it's going to be because it varies so much. A specialist may be up to $60, $75. Again, varies by plan. And then you have coinsurance for certain services, and that also varies. There's a copay when you go to urgent care, to the emergency room, and there is a maximum out-of-pocket with Medicare Advantage plans. So the most you would spend out of pocket for this year is $7,550. That does vary by plans also. So it could actually be lower. We've seen some that are $6,700, $5,800, but the absolute maximum for this year would be $7,550. Okay. Another important thing to know about Medicare Advantage plans, though, is that they are network plans. What does that mean? That means you got to go to a doctor who's in the network that's contracted with this plan. Not all doctors accept all Medicare Advantage plans. Not all doctors renew the contract with the plan, so it may change from year to year. Very, very important to check with your doctors, check with your specialists to make sure they're working with that plan this year, because it does change. We are more than happy to call a doctor for you to find out who they're working with. But that is very key with the Medicare Advantage plans, to make sure you're going to see a doctor who's in the network with that plan. Okay, let's go back over to Medigap plans or Medicare supplements. These are plans that do have a monthly premium. they are standardized by the federal government. So, for example, Medicare supplement plans have letters associated with them. You may have heard of the Plan F or Plan G, Plan N. Let's take G for example. Plan G across the board is going to be the same from state to state. However, companies get to choose the premium that they charge you, but the benefits are the same. Now there are a couple of states that, I think it's Minnesota, Wisconsin, maybe Massachusetts, that are a little bit different, but for the most part, they are standardized by the federal government. So I put up some examples of what a Plan G would cost. Now a Plan G covers all Medicare related expenses after the $203 deductible. So you would be responsible for that part, and then Plan G picks up the rest. So for example, 65-year-old female in North Carolina would be about $96. In South Carolina, a little bit less at $93, and then in Georgia, $119. 65-year-old male, $107 in North Carolina, $105 in South Carolina, and $132 in Georgia. Now I did just pick a zip code kind of in the middle of each state to try to get just examples to show you guys, but it is different per county. Plan G, these were all Plan G quotes. So again, this is a Medicare supplement. It works with original Medicare, so it is secondary to original Medicare. So you would show your doctor both cards. Now, back to a Medicare Advantage plan, you would get your Medicare through the Advantage plan. So these cannot work together. You cannot have a supplement and an Advantage plan, but you can have original Medicare and a supplement. But Medicare Advantage, if you were to choose that route, basically you would get your Medicare through the Advantage plan. If that makes sense, kind of. Okay, real quick, I did want to go over Part D just briefly. Hope I didn't just walk out of the camera view there. Sorry if I did. Part D. There is a premium associated with this plan. This is your prescription drug plan. Premiums, on average, we see anywhere from like $14 to $45. There are some that are higher. Really depends on the prescriptions you're taking. There are some specialized prescriptions that may only be covered under certain plans. Those premiums might be higher. Important that you do your work, that we do the work to get you in a plan that's going to cover that for you. A lot of them do have deductibles. The highest deductible, it's $445 for this year. Some are less, some don't have a deductible. However, there is something called a donut hole with prescription drug plans. Have you heard of this? A lot of people have heard the term, but come to us like, what is a donut hole? What does this mean? I don't understand. It is kind of confusing because this is how it works. So as you're going through the year, getting your prescriptions, when you hit $4,130 in prescription expenses, you enter the donut hole. And at that point, you are responsible for 25% of your prescription drug costs. That can get a little bit high, especially if you are taking some of those specialty tier drugs. So 25% until you get to $6,550. Once you hit that, you're paying a small copay. That's catastrophic coverage. So after that, you're doing just a small copay. But we like to help people plan for that so they can figure out when or if they're even going to hit the donut hole, because it can get costly. So we try to forecast that out for you, just so you're prepared. You know, if your prescriptions had changed, and you want to know, well, okay, I'm taking this new one. Is this going to affect me? Am I going to get to the donut hole sooner? What's it going to cost when I get to the donut hole? Help me figure this out so I'm more prepared. We want to make sure you're prepared. That's the whole point of all of this, is to make sure that you have the information so that you're informed and it's not overwhelming. You're not confused about it. I wanted to break this down. I enjoy doing this, and I just wanted to break it down as simply as possible. So I'm gonna step out of the way for a minute so you can see the board. Make sure I covered everything. So just to go back over it, I wanted to go back over what works with what. So a lot of times the first question we'll ask people when we're talking about Medicare and then they say, I don't know what I have. We will ask, well, what cards do you show your doctor? And if they say, just a company name, WellCare, Humana, Aetna, United Healthcare, then most likely they have Medicare Advantage plan. But if people are like, well, I have two, I show them my original Medicare and my supplement, or my Planet G card. These two work together. It is a supplement because it supplements original Medicare. Does that make sense? It is secondary to original Medicare, whereas this basically takes the place of it. So you get your Medicare through the Advantage plan. I hope that wasn't too much information in a short amount of time, because it was a lot. I felt like I was really giving you a lot, and if I talk too fast, I apologize. I get really into this sometimes. I just want to get you information. So the next video, video 3, is going to be, when can I sign up? How do I sign up? What happens if I don't sign up when I'm supposed to? Is there a penalty? It's also really good information. So we're going to do that in video 3. But if you have questions, please reach out to us. More than happy to help you. You can give us a call at 1-800-615-1440, or you can email me at lauren@dearretirement.com. That's DEAR, lauren@dearretirement.com. You can check us out on our website. All of our information's there, all of our contact information. If you're local, come by and see us in the office. So let me know if you have any questions about this. This, again, is just the Medicare coverage and costs, the basics. I'll see you next time for video number 3, when to sign up.